combination of a subdural hygroma with homeopathy. Now, exactly before getting into the topic, the case proper, is a case report. So this is documentation of a case report, which is a rare case report. Basically, you will not find frequent cases of subdural hygroma coming to your clinics or OPD. And as you know, reporting rare cases is important because it's also stand as an evidence of evidence-based medicines, which we know. So with this, you should know what is a subdural hygroma. First of all, you know what is a subdural space, because as you know, there are three layers of meninges: the dura mater, the arachnoid, and the pia mater. And the space between the dura mater and the arachnoid mater is actually what you call as the subdural space. And if in this space somehow there is some collection of CSF, that is cerebrospinal fluid, which may be due to many causes. As you can see, it may be idiopathic at times, it may be traumatic, which is the most common cause, and it may be post-surgical, which is also a very common finding. Then that CSF can leak into that subdural space, and it can give rise to a situation what is called as subdural hygroma. It might happen that sometimes blood might come into that space, which you call as subdural hematoma. And recently, if you see, a subdural hematoma case report has also been published in a reputed peer-reviewed journal. So, regarding the subdural disorder, if I say in a nutshell, there are two things which I have just found as per the literature research, that this subdural hygroma and subdural hematoma, which has been published so far, and which is available in the internet sources if you go for an access. So coming back, so causation is idiopathic, traumatic, or post-surgical, and the clinical features most interesting. Most of the patients are asymptomatic. That's why it may not be an important feature or maybe an important finding for patients, or patients might not be coming to you, but there may be some association of some non-specific headaches at times, which was in this case, and there may be some altered mental status. And very rarely it might also can give rise to some life-threatening conditions, especially if it is a result of some post-surgical issue. If you see ICD-11, it has been having a code of 8B02, and as I said, it is followed by some trauma or neurosurgery. And if you see the data, it is 5 to 20% of the space occupying lesions which we find in brain. And most commonly in elderly patients, it is due to trauma, but in children, it might also be due to after some infection. And the management, the conventional management, is basically surgery, which is burn hole evacuation, or subdural peritoneal shunt. And there is one study which I want to highlight, which has been a paper published in Egypt, that in a prospective 1-year clinical trial, there was two groups. Was a conservative treatment group, another was a surgical treatment group, and no statistical significance